Hi, my name is Tristan Lugo, and welcome to my presentation on ALS. This is for human physiology, Professor Ali Arale, and the date is August 30th, 2025. Okay, so anatomy. So ALS is a neurodegenerative disease that targets the motor neurons. The upper motor neurons degenerate, and then the lower motor neurons die over time. Skeletal muscles waste away due to loss of nerve signals, and normal muscles are bigger and have more nerve connections. ALS eventually reaches the respiratory tract, usually around 2 to 5 years later. The diaphragm and the intercostal muscles are generally affected more. Muscles that are essential for breathing stop working, so you'd get symptoms like slurred speech, difficulty swallowing, and speech issues. So the physiology behind ALS is ALS affects the motor neurons that normally control all voluntary movement. And in a healthy body, upper motor neurons in the brain send signals using the neurotransmitter glutamate, while lower motor neurons in the spinal cord release acetylcholine at the neuromuscular junction. That acetylcholine triggers muscle contractions by opening sodium channels and releasing calcium from storage inside the muscle cells. So at that point, calcium then allows actin and myosin proteins to slide past each other, which produces movement. And for this process, muscles rely on ATP, which comes from creatine phosphate, glycolysis, and mitochondrial respiration. And then other hormones like insulin and thyroid hormones also help regulate energy use. So, like I said, the diaphragm and intercostals are operated by the phrenic and thoracic nerves, and those are they degenerate over time. And then also the medulla and pons regulate the breathing rate and rhythm, so that explains the slurred speech, the difficulty breathing, etc. And the chemoreceptors also regulate your breathing patterns as well. Cranial nerves 9, 10, and 12 also control swallowing and speaking. Those degenerate over time. And these are all the reasons why the ALS affects all these body systems. Now the pathophysiology behind this. So in ALS, the motor neurons that normally send signals to our muscles begin to degenerate. Like I said, the upper motor neurons lose their ability to properly transmit glutamate signals, and then the lower motor neurons start releasing acetylcholine at the neuromuscular junction. Without this communication, muscle fibers are no longer activated, and as a result, muscles atrophy because the use it or lose it also applies at the cellular level. So no stimulation means shrinking and weakening over time. And then since ATP is in use, calcium signaling and the contractile proteins like actin and myosin depend on motor neuron input, and this disruption completely breaks normal muscle contraction, throws the body's balance off. Okay, so the same process affects the diaphragm and intercostal muscles, which are essential for breathing. And as the motor neurons die, these muscles weaken, and the body can no longer maintain proper oxygen and carbon dioxide levels. So this disrupts the homeostasis since chemoreceptors sense rising carbon dioxide, but the muscles cannot respond effectively. ALS is mostly diagnosed by ruling out other conditions, but doctors generally use a clinical exam called the EMG test to measure abnormal motor neuron activity, along with MRI scans to make sure symptoms aren't caused by something else. Genetic testing is also used, but for treatment there is no cure. Once you have ALS, it's there until you die. There's two medicines that work: is riluzole and edverodone. So ALS is a chronic and progressive disease, meaning it doesn't go away, and unfortunately remains fatal. But the only drugs that I said in the last slide only delay progression. The side effects on these, for riluzole, it can cause fatigue or liver damage because it interferes with glutamate activity and metabolism. And then edverodone sometimes causes headaches or bruising because its antioxidant effects influences blood vessels and clotting. So AI is also helping with ALS care. Machine learning models analyze EMG, MRI, stuff like that to predict disease progression and help with treatment plans. And then also the AI voice bank and speech technology allows patients to maintain communications even if they can no longer speak themselves. Quick facts. Peak risk in adults aged 55 to 75, especially 70 to 79 years old. This is stat by ALS United. Matter of fact, all these stats will be from ALS United. Slightly more common in men, higher prevalence among white individuals versus Black, Asian, or Hispanic, and then 90-95% of cases are sporadic, and then 5 out of 10 are genetic. Age-adjusted incidence declined slightly from 1.7 to 1.5, and the global average is 2 new cases per 100,000. The global prevalence 2 to 3 per 100,000, so it's not very common. Most patients live 2 to 4 years after diagnosis, and about 50% die within 30. And approximately 20% survive between 5 and 10 years. So around 10% survive 10 years or longer, and then months of symptom onset, respiratory failure is leading cause of death. And here's my reference page, and thank you so much.